Good afternoon. My name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability. And I'm pleased to come to you today to continue our series in how to get the most out of your health insurance coverage. This is a series of these Facebook Live events we have been doing. We have covered topics on rehabilitation and habilitation benefits, on mental health, on medical devices. And today we're going to be talking about getting access to specialists. So if you haven't had an opportunity to look at those three prior Facebook Lives that we've done over the last 3 Wednesdays, I'd encourage you to go back and check those out on both our Facebook page and on our YouTube channel. So I would encourage you to check those out to find out more about those topics. But like I said, today we're specifically going to be focusing on getting the most out of your health insurance coverage as it relates to accessing specialists. We have a very special guest today I'd like to bring in to the conversation. So Karen Cushnyr is going to be our guest today. And we want to welcome you, Karen, to the presentation today. So why don't you tell everybody a little bit about yourself, who you are, where you're from, and any information you want us to know about your disability.
Of course. Thank you for having me. My name is Karen Cushnyr. I am an adult living with spina bifida. I live in Albuquerque, New Mexico. I have had a career in medicine for almost 25 years until I was medically retired. And for the last 10, 15 years, I've been working on advocacy, helping others with their issues, navigating what they need help with, advocating in our state to try to get specialized health care for those of us that are adults living with spina bifida, and then also at the national level. I also work with service animals. I have a Great Dane. You might see her once in a while in this, walking by, checking on me. And she keeps me mobile, keeps me out of a wheelchair, and is an alternative medical device to just, not being able to be out and about and do what you want with your life. Other than that, I have 3 grown children and 1 grandson, and I won't whip out the pictures of him right now. We can, maybe do that later.
All right. For starters, can you just tell us, just for some background for people that are following the series, always wanted to start off by just getting some basic information about your insurance, what kind of insurance you have, and what are the things you sort of rely on your insurance for?
Well, I am fortunate enough to have commercial insurance through my husband's employer. And I have been fortunate enough that most of my life, through my working years, I was able to have commercial insurance as well. I am currently insured with Blue Cross Blue Shield. And I also have Medicare A, but that doesn't pay for too much unless you have a surgery or a hospitalization. So Blue Cross Blue Shield of New Mexico it is.
Okay. And so what are some of the things that you rely on that coverage for that, you sort of couldn't make do without if you didn't have?
I would say the biggest thing right now is prescription coverage, of course, and then everyday access just to routine healthcare. If I didn't have that, I wouldn't have that insurance coverage. I wouldn't be able to have my health at the level that it is today. So I am very fortunate in that.
Okay. For people who may not understand spina bifida as a disability, could you explain to people sort of who are some of the specialists you would typically see for that particular condition?
Of course. Spina bifida, the short answer is it's a neural tube defect, happens between the 8th and 10th week of gestation, most times before mom even knows she's pregnant. So what this does is every single person with spina bifida is a little bit different. That's why they call it a snowflake disease. There are a lot of us living with it, about 177,000 in the United States. Not as big a disability as others, but we're still here. As a person with spina bifida, I like to say that it's just a spinal cord injury because that helps some people understand it a little bit easier. And so I have to have access to a neurosurgeon to follow me. I have to have access to a neurologist, an orthopedist, a urologist. and sometimes a nephrologist to specialize in, specialized kidney care. Not That's just the gamut of specialists at this point in my life. But I also need, a primary care doctor, and then all the other things that go along with helping take care of yourself.
Okay. And in terms of the insurance that you've had and you've used, how has accessing those specialists worked over the years?
Well, each plan I think is different, and that's something that I encourage everyone to read the fine print in your plan. We're fortunate that we don't need a referral to go to a specialist. We can have that conversation with our primary care, a family practice doctor, and they may say, gee, you need to go to a podiatrist or here, and I can call up and make that appointment. What has happened recently, and when I say recently, it's like in the last 10 years, is that many health systems, while your insurance may not require a referral, the health system itself may require a referral. So your primary care, for instance, like when I wanted to see neurology, didn't really need a referral because my insurance would pay for it. But the hospital wanted to make sure that I was going to be seeing this specialist for the appropriate thing.
Okay. And with navigating specialists and that, I know especially a lot of people with disabilities. I'm sure that people with spina bifida feel the same way. Get very particular about their doctors, especially if they find a provider that they like and want to stick with them. Have you ever experienced issues where you've been switching plans and you've had to the provider network has changed and has forced you to make a change in providers, or have you been fortunate and not had to worry about that?
Well, I it's a little bit different here in New Mexico. We have a pretty scarce pool of specialists. So, what happened during COVID was a lot of those specialists shut down, and then many of them didn't come back
Mm,
because they moved to another state. They were scooped up by other health systems around the country that could pay them better or keep them working. So yes, I've had a good deal of experience since I've moved here to New Mexico to constantly be, you just get settled with one provider and you know them, and you just appreciate them so much. And with spina bifida, you have to educate them to a certain level because many providers don't get much education about spina bifida. And you feel like, okay, this guy's good, and you have a good working relationship, and then you find out he's retired or he's moved. So um, from that perspective, yes, I haven't had to change providers because of a plan change for a very long time.
Now, you indicated earlier you were working in the medical field before. Can you talk a
Mhm.
little bit about your work there and how you've helped people navigate some of these issues as well?
Well, early in my career, I worked at the Cleveland Clinic Foundation in the Department of Dentistry, and we did very specialized work there with the prosthodontists. They basically took over where the plastic surgeons couldn't, or if somebody was, born, like a baby was born with a hole in their upper palate and needed an obturator, we had a specialist who could make that, who could fit that. And so that's not traditional dentistry. That's, what the insurance companies at the time were just calling durable medical equipment, but
Mm,
it fits inside the body so the baby can feed. We had people who, through cancer, had radical neck surgeries, lost half their jaw, parts of their face. I mean, it was very educational, and it was there that I learned that you can really challenge the medical insurance companies with the information, because a lot of times if the patient doesn't know what to say, then they need the doctor to stand up and say, okay, here's what we can do. This, for instance, the baby is going to keep growing, and ultimately that obturator needs to be, that's what they call the little thing that fits in the hole. That obturator is going to have to be fixed and recreated multiple times. And many insurance companies would say, we pay one fixed price. That's it for the life of the child. And so you have to go back in and really do battle with the insurance company on behalf of the parents, because I I've been in their shoes. I've had a 10-week, a baby at 10 weeks early, a 10-week early preemie. And so I know that, you just have to challenge the status quo to make that happen.
Hmm. And I know, from knowing the policy side of things, the Affordable Care Act certainly changed the rules as it related to insurance companies putting limits on how much money they would spend on someone. But they still are, and this is an important reminder, they still are allowed to, limit how much or how many services. So, saying, for instance, something like that with a durable medical equipment or some sort of other prosthetic or any of those kind of things, we've seen insurance companies still under the law, they're allowed to limit those numbers of services. So it's a good reminder that people think that the Affordable Care Act did a lot of good, which it did,
Yes.
but there still are some of those kind of things that insurance companies do to that will still end up sort of limiting the amount of services that people receive. So you already started answering the next question I was going to ask, which is, what are some of the barriers you've seen in your own care and in those you were helping in terms of getting access to specialists, and what did you sort of do to help either navigate that on your own or help other people navigate that?
Well, in my own care, with wanting to have a child into my 30s, when I had doctors telling me, "No, you can't. No, you can't." My neurosurgeon was, I always say that I made the deal with the devil, that I would go as far as I could in this pregnancy, and he would take care of me. After that, I had a 30-weeker in a NICU, who did very, very well. She's graduating from law school in a couple of months. But it took a lot with, my bad experiences with hospitals and insurances have created good experiences, because that's where I learned with my own child and my own situation, where I might not have walked again. I might have had tons of complications. Our child might have had tons of complications. And so, again, you just had to say, this is the care I need. This is who I need to see. For me, it was getting access to physical therapy, to occupational therapy, to helps to find out, what else was going on with my spinal cord, because I could sense that something just wasn't right. And really, again, I hate to say doing battle, but just calling and talking to the staff of the physician's offices and saying, look, something just isn't right. Could you please give me a referral to this doctor? I really need to see this. And then sometimes it comes to a point where you just have to say, hey, this is the care I need, and I'm going to go and get it. The other, point of reference in my life right now is that in the last 10 years here in New Mexico, I've lost pretty much every single one of my specialty providers.
Mhm.
So I've been forced to look outside the state to other spina bifida clinics around the country to see where I could get care. And so for that, I've, ended up back at Cleveland Clinic, and the insurance here wanted to say, well, that's going to be completely out of state, out of network. You could have seen somebody here for that same care. And I've had to go back to them and say, I appreciate that, but no, this provider doesn't take care of patients with spina bifida, or was not the right fit for this particular problem. And I've been able to get it covered most of the time, 100%, because I've had to travel. But a lot of people, they don't even ask. They just assume when they get the first no from the insurance company, when they've had to take their child to another place, out of state, out of network, that they're just going to be faced with that burden. And it's important to always ask.
Mhm. A good reminder there that, yeah, just don't always take no for an answer immediately. Sort of always having to be that self advocate and push back is always a good reminder for everyone. Any other challenges that you've experienced with using your insurance and providers over the years?
Most definitely. I would think in the spina bifida community, the biggest thing that comes up is, access to a urologist. And then secondary to that is access I needed a new wheelchair. And you would have thought we were inventing wheelchairs for the many hoops I had to go through. And I finally, couldn't find anybody here in this state. So we drove to Phoenix, Arizona, found somebody who did the measurements, did everything, and ordered the chair. And then I had to back submit that to the insurance company to recoup what we could. And it was at that point that one of the nurse, I forget what they call them. They're like guides, case managers, maybe,
Mhm.
said, well, if you had just explained it, that this is what you needed. And I just wanted to say, I did explain it that way,
Mhm.
but, because it wasn't exactly what the booklet said, they weren't willing to do that.
Yeah.
So,
Well, if you haven't had the opportunity to, you can listen to the conversation we had last week when we talked about
mhm.
wheelchairs and durable medical equipment. And Nuria interviewed me, Nuria, our staff person, interviewed me about my experience I just had with getting a new wheelchair. So I can certainly relate to that on my own. Finally, I guess we'll wrap up here and want to know if you have any other tips or tricks that you've learned over the years that maybe people with disabilities would find useful as they try to navigate insurance and try to get access to the specialists that they need for their care.
I think some of the biggest tips is just follow your gut, whether it's for yourself or for your child that needs access to that specialist. Just, don't give up. Don't look at that provider or your family practice person and say, okay, and just let it go. Because as we age, and I know in the spina bifida community, this is very true. We're living longer. We're aging into place here where they never thought we would. Normally we didn't make it past 25. And I heard all of that. You won't make it past 40, you won't have children, you won't. I mean, I heard the whole long list of you won't, you won't, you won't. But I would just encourage each person to, if you don't know and you're going someplace, call the practice, ask to speak to the practice manager, explain that this is the problem you're having, and how can they help you get the care that you need. And 9 times out of 10, they will find a workaround. I know that was the deal recently. I had a niece that was having a child with some heart issues, and there's a big concern that there might be huge medical bills after this, and she didn't really know what to do. And so I just called the hospital and I said, hey, this is what's happening. What should she do? And they said, oh, well, she should call us and we'll enroll her immediately. There's these services available. So I think that's the backstop that a lot of people don't understand is we do as a society have programs and have these backstops. And I know some people think that just because they have commercial insurance that maybe they're not entitled to it, or maybe they don't want to have to take that kind of help. But it's all part of the process to be able to ensure that we're getting the medical care we need to thrive.
Okay. Well, thank you very much. That's fantastic, and that's quite helpful. And hopefully, people will be able to take advantage of things. Some of those tips and understanding that, yeah, sometimes it's also finding the right person in an insurance company, whether it's a case manager or someone like that, that can really help navigate some of those issues to get access to the specialists you need. And the other thing I always remind people is make sure if you're getting new insurance, you're checking the provider networks, that they're going to have the folks you need that are going to be able to take care of the things that you need. So thank you very much for joining us today, Karen. And we want to thank you and appreciate the insight you've given and the experience that you've shared.
Thank you for having me. You have a good rest of the day.
Thank you. So with that, we'll wrap up today. I want to thank you all for joining us, and a reminder that next week we will continue this series on getting the most out of your health insurance. So please join us again. We're still trying to nail down the individual who will be joining us and the topic. So look for more information in our newsletter that we send out every Friday. We'll have that information for you. And join us next Wednesday for another Facebook Live and YouTube Live session on getting the most out of your health insurance coverage. Thank you for joining us.